We're going to talk now about the thyroid conditions that actually can lead to changes in your physiologic thyroid hormone levels. One of the more commonly talked about entities that will show up on your board questions is this toxic multinodular goiter. So I want you to associate this with the non-toxic multinodular goiter, at least in the sense of appearance, physical exam findings, all of that good stuff. But in this case, the thing that makes it toxic is that you are now beginning to see effects in your serum levels of your thyroid hormones. Most commonly, you're going to see hyperthyroidism associated with your toxic multinodular goiter. This is actually the second most common cause of hyperthyroidism after Graves' disease, which is the reason why it shows up on board questions so frequently. You're going to manage this just like you would other forms of hyperthyroidism, so using either methimazole or PTU. You can consider coordinating with your surgical colleagues about possibly radioactive iodine therapy being an option for your patient. This is where they administer radioactive iodine, which is preferentially taken up by those toxic active sections within the thyroid gland itself. And ultimately, if either of those fail, surgical intervention is required.